Hi, I'm Josh Ratner, and welcome to HealthAlliance and You, a health and wellness series brought to you by HealthAlliance of the Hudson Valley. If you're addicted to drugs or alcohol, you're not able to control your drug use, and you may continue using the drugs despite the serious harm it causes. You may want to quit, but most people find they can't do it on their own. Here are Dr. Riccardo Esposito, Medical Director of HealthAlliance Addictive Services, and Nace, our Administrative Director of Substance Abuse Services and Community Rehabilitation. They'll first define what an addiction is, and then talk about treatment programs.
Essentially, addiction is a dependency problem that starts sometimes minimally, but can continue on to a point where a patient requires to have it every day at larger doses, whatever it be, and mostly so that they're not sick from the withdrawal. So if you have withdrawal symptoms or cravings for a certain item or drug, this is addiction.
One of the thumbnail kind of indicators is that if a person is having a drink and they can't predict the outcome, that's a problem. We have many programs at HealthAlliance. Inpatient, we have a medically managed withdrawal services. Many people refer to that as a detox. And that's a medical service that's designed to help somebody who's suffering from withdrawal symptoms avoid major health issues. Following that is the inpatient rehab, and that's designed to help somebody post-acute withdrawal to get through a really rough period, and to start to develop some foundations for recovery once they leave the inpatient setting. So once they leave the inpatient setting, they can come to one of our programs that are known as Bridgeback. And we have a variety of programs that we offer there, and in 2 locations. Bridgeback has a location in Kingston and in Saugerties. In the Bridgeback, there's a day rehab program that provides services for people who need a lot of help for an extended period of time. And they're all variable stays. But that's like a 4-hour day, 5 days a week. And it's really an immersion program into recovery. We also offer outpatient services. People may come once a week, they may come 3 times a week for various groups that are designed for their needs. We have an early recovery program for people who have not yet reached or had the damage in their life that they need the intense programming. And we also have an adolescent program. And we have a special needs group, a special issues group that was designed to meet the needs of people who were unable to be successful in the standard programs. And then we also have a methadone treatment program for people who are diagnosed with opiate dependence and meet the state and federal criteria for that. The primary goal is abstinence from all illicit substances and substances that create a problem for a person. So if a person has a problem with any known substance, we work at helping them to abstain from use of that substance. There are times when people aren't ready to do that all at once. And so then on an individual basis, depending on the health of the person, the program that they're in, what the needs are, their legal issues, we can work with people to reduce their use with the hope that we're moving in the direction of eliminating it.
The most important thing about addiction is to understand that it is a disease just like heart disease or diabetes, and that people deserve kindness and help as they would with any other disease. There is certainly help for it, and we're fortunate in our community to have as many services as we do.
Somebody with an addictions history, they're more likely to have also a psychiatric history. Someone with a psychiatric diagnosis may also be more inclined to develop an addictions issue. But in general, it gets everybody. it crosses all boundaries. People from all walks of life and all socioeconomic, employment, educational levels, where they live, are affected by this. I don't know a family that isn't.
Alcoholism and probably other drug addiction also is somewhat inherited because, as they say, the way your brain reacts to these substances is almost predisposed. And this certainly seems to be inherited.
I think it's very important for people to not look at it as a good and bad or a good and evil, but it's a physical, an emotional, and spiritual condition, and that it impacts people, across the board, and that if someone is suffering from addiction, it's a medical state, and they need help. They really do need help. And if they don't get help with the addictions, there's a high likelihood of further medical problems, legal problems. We have our county and state correctional facilities are loaded with people who suffer from addictions and mental health. And if we don't treat them in the community, then we end up incarcerating them. And when they're incarcerated, they return to the community. Usually, certainly not better off than when they went.
People who are addicted and come to clinics or various programs do have shame once they become clean from their drug and realize, I see it all the time in the inpatient setting as well as the outpatient setting, and they try to really regroup their lives, and we try to assist them the best we can with various services that we have.
And we need to find a way to instill hope. Hope is very important to everyone, but for people suffering from addictions, sometimes they've lost hope. Things have gone wrong so many times that they don't necessarily see a chance for them. And we need to let people know that, again, that people are just people and they can change their life. And we're here to help them if we can.
We hope you found this segment helpful. Remember, overcoming an addiction and staying drug-free require a persistent effort. Knowing where to find help is essential. HealthAlliance offers a full range of addiction services for adults and adolescents. Our mission is to restore patients as vital, healthy members of society. For more health information or to view this episode again, visit hahv.org. I'm Josh Ratner. Join us again next time for another segment of HealthAlliance in You.